Hey, future nurses! Welcome back to my channel. Studying for the NCLEX can be tough. That's why I'm here to help you conquer this beast. In this video, we're tackling the top 20 next generation NCLEX NGN questions and answers. This new format tests how you think like a nurse, not just how well you can memorize facts. So grab your study buddies, a notebook, and let's crush the NCLEX together. Oh, and hit that subscribe button and the notification bell so you don't miss out on any future videos. Now, let's get those brains fired up. Alright, question number 1. Imagine you're working with a patient who has COPD and is experiencing shortness of breath. What's your top priority? Ensuring they can breathe. Administering oxygen as prescribed is crucial. Remember, with COPD, we always want to be mindful of oxygen toxicity. Monitor those oxygen saturation levels closely and adjust the flow rate as needed. On to question 2. You're analysing a patient's lab results and notice the presence of serum ketones. This is a major red flag for diabetic ketoacidosis, or DKA. DKA happens when the body doesn't have enough insulin to use glucose for energy. This is serious and requires immediate medical attention. Let's talk about question 3. You're about to administer furosemide, Lasix, a diuretic, to your patient. What electrolyte imbalance should you be most concerned about? Potassium. Furosemide can cause your body to flush out potassium along with excess fluid. Always check those potassium levels before administering and monitor them closely. Moving on to question 4. You're caring for a post-operative patient who's been prescribed opioids for pain management. What's a common side effect you should be on the lookout for? Constipation. Opioids are notorious for slowing down the digestive system. Encourage fluids, fiber-rich foods, and early ambulation if possible. Question 5. Everyone. You're assessing a patient experiencing chest pain. What diagnostic test is crucial in this situation? Obtain a 12-lead ECG immediately. The sooner we identify the issue, the quicker we can intervene and potentially save lives. Let's tackle question 6. You're reviewing a patient's lab results and see their INR is 5.0. They're also on warfarin. An INR of 5.0 is significantly elevated, indicating a high risk of bleeding. Administering vitamin K as prescribed is crucial to help normalize their blood clotting. Ready for question 7? Let's go! You're managing a patient with hyperkalemia, meaning they have high potassium levels. What medication might be ordered to address this? Sodium polystyrene sulfonate, also known as Kayexalate, could be the answer. This medication binds to potassium in the gut and helps remove it from the body. On to question 8. You're caring for a patient experiencing an acute asthma attack. What medication would you expect to administer first? Albuterol, also known as Ventolin. This bronchodilator quickly opens up the airways. Question 9 coming at you. You're monitoring a patient during dialysis. What vital sign requires particularly close attention? Blood pressure. Dialysis can cause fluctuations, often leading to hypotension. Stay vigilant. Chapter 10. Hepatic Encephalopathy. Ready for question 10? You're assessing a patient with cirrhosis and notice they're confused and have asterixis. These symptoms point to hepatic encephalopathy, a serious complication of liver disease. Chapter 11. Administer antibiotics as prescribed. It's time for question 11. You're caring for a patient diagnosed with bacterial meningitis. Administer antibiotics as prescribed. Bacterial meningitis is life-threatening. so every minute counts. Let's move on to question 12. You're educating a patient on how to take alendronate, a medication for osteoporosis. Tell them to stay upright for at least 30 minutes after taking alendronate to prevent esophageal irritation. Question 13. Here we go. You're responding to a patient experiencing anaphylaxis. What's your first course of action? Administer epinephrine immediately. It works quickly to reverse the allergic reaction. On to question 14. You're assessing a patient with a history of peptic ulcers. They're now experiencing sudden, severe abdominal pain and a rigid abdomen. This sounds like a perforated ulcer, and it's a surgical emergency. Let's move on to question 15. You're educating a patient starting on an ACE inhibitor for hypertension. What common side effect should you mention? Cough. ACE inhibitors are known for causing a persistent dry cough. Question 16. Coming right up. You're providing dietary teaching to a patient on warfarin. What type of food should they consume in moderation? Leafy green vegetables. They're packed with vitamin K, which can interfere with warfarin's effectiveness. Ready for question 17? Here we go. You're caring for a patient with type 2 diabetes who is prescribed metformin. What potential complications should you be aware of? Lactic acidosis, especially in patients with kidney issues. Question 18. Almost there. You're monitoring a patient receiving heparin therapy. What lab value is essential to track? PTT, or partial thromboplastin time, to ensure the heparin is working effectively. On to question 19. You're providing dietary counselling to a patient with chronic kidney disease. What dietary modification is crucial? Reducing phosphorus intake to prevent complications. Last question. You got this. You're caring for a patient experiencing an acute pancreatitis attack. We need to get those IV fluids flowing. And there you have it, future nurses. We just tackled 20 challenging next-generation NCLEX questions. Remember, the key to conquering the NCLEX is to understand the why behind the answers. If you found it helpful, give it a big thumbs up and share it with your nursing squad. And don't forget to subscribe to my channel for more nursing tips, tricks, and encouragement. Now go out there and crush that NCLEX. I believe in you.